The sideline position is one of the best ways that a massage therapist can address the hip and gluteal region. It's important to have a pillow underneath your client's head and then pillows supporting your client's ankle and knee so that the knee and the hip joint are in alignment. When it comes to doing hip and gluteal work, it's important to remember that there are 4 bony landmarks that you should remember. The first one is the iliac crest in the superior portion of the hip. On the lateral side, you have the greater trochanter, where all of the gluteal muscles insert to. Then posteriorly, you have the ischial tuberosity and the lateral border of the sacrum leading into the coccyx. The fiber direction of the gluteal muscles is very easy to remember. It creates this fan-like fiber direction, all leading to the greater trochanter. So beginning here, we have the anterior glute medius fibers. Then we start to venture more posteriorly into the oblique fiber directions of glute max. Here we have piriformis running from the greater trochanter over to the lateral border of the sacrum. And then you have the last 5 deep lateral rotators running from the ischial tuberosity and the lateral sacrum over to the greater trochanter. To begin your hip work, it's best to warm with some loose fist compressions and open palmar compressions. You want to try to create movement in all of the gluteal layers. You can apply a nice broad form in between the iliac crest and the greater trochanter using the lateral aspect of your ulna and using the therapist's weight to lean down into the anterior glute medius. Remember that the fascia and all of these muscle layers are very thick, and it takes time to warm them up. It takes time for change to occur. So it's important for the therapist to be patient. So here we have a cross fiber compression to anterior glute medius. If you would like to go more specific, you can by slightly flexing your elbow. But you really want to avoid going full point, as you might bruise the tissue then. It's really best to keep yourself closer to a 90-degree angle. You can then come down and apply either thumb or fingertip compressions to the greater trochanter. Pressure always get going down into the trochanter. This can be done with speed or in a slow rhythmic motion, going around and addressing all of those attachment sites around the greater trochanter. To work the bellies of the muscles of glute medius, glute maximus, and even the belly of piriformis, you can apply slow, deep fascial twists with a loose fist. It's really helpful to create movement in between these muscle layers. Pressure, again, should always be down towards the feet so as to possibly encourage a posterior pelvic tilt. You can then also apply a broad forearm compression at the lateral border of the sacrum. Again, your pressure is going to go down towards the feet, and this may even open up a space between the iliac crest and the 12th rib. You can use sustained pressure here, or you can even create more of a transverse friction movement using your back leg, your lunge leg, to apply pressure. Then coming around, you're going to start to work the ischial tuberosity. Again, either you're using digital thumb compression, fingertip compression, or if your client is up for it, you can use a forearm compression, but it's really important to make sure that tissue is nice and warmed up. You don't want to bruise the tissue. So applying pressure all around the ischial tuberosity, you're going to address the other 5 deep lateral rotators. You've got quadratus femoris, the superior and inferior gemellis, and then the internal and external obturators. To finish up the gluteal work, you can create a smoothing out motion by doing compressions with a loose fist or palms. And one of my favorite ways to end hip work and to transition to another body part is by putting your client into a passive posterior pelvic tilt. By doing so, you can take your superior hand, which is your hand closer to the head, and place it around the ASIS, your inferior hand, which is closer to the feet, and you're going to place it on the sacrum. And you're going to create this counter movement, making sure that you use your hips. It'll be much more effective if you use your hips. It'll be easier on your body. So superior hand on the ASIS, inferior hand on the lateral sacrum, and you're going to create this counter movement using your lunge to create a posterior pelvic tilt. And that is one of the best ways that you can work the hips with your client laying on their side.